This morning, ang pag-usapan po natin ay ADHD. Ano nga bang ADHD? And of course, kasama po natin ngayon si Dr. Lolita Serrano and of course si Miss Bianca Von Wilfed.
Good morning!
Good morning and welcome to Rise and
Rise and
Shine.
Shine.
Good morning.
Ayan, partner, umpisahan na natin.
Okay.
Umpisahan natin, ADHD.
What is
this all
ADHD?
Okay, what is ADHD?
Uh-huh.
Actually, it is a neurobiological developmental disorder. And a while ago, you were asking me, is it a disease? No, definitely it is not a disease. It is a brain disorder, actually. So there is something wrong with the imbalance. There's an imbalance in the neurotransmittal of the brain.
Okay.
So it gets something to do with the brain, a disorder of the brain. That is why these children, actually we're talking of children, and these children cannot focus. They tend not to focus and behave inappropriately.
Anong range ng age?
Okay, the onset is usually at 7 years old.
Alright.
That is why some parents would say, oh, they are just kids, most especially the terrible twos. Di ba sila yung mga malilikot?
Yun nga eh,
they are
sabi nila,
hyperactive.
may attention.
Yes, they have very short attention span. It's still normal. It's still very normal. But once the the behavior, the inappropriate behavior persists, that the child can no longer focus, cannot sit down for a longer period of time, then somehow there get to be, shall we say, a red flag is up. The parents must somehow be alerted, be alert to find out if there's something wrong with the child.
So is this curable or?
Actually, the word curable, when you say curable, mawawala. It is treatable.
Controllable.
But it's not curable. So it is a lifelong disability that can occur later on in life. That's why a lot of relationship went wrong later on in lives because somehow maybe one of the partners, maybe the female or the male, is suffering from this sort of disorder.
Okay.
Because it carries on up to life.
So it's not curable, but it's
treatable.
controllable.
Treatable. Meaning they can be intervened through behavior modification or behavior therapy, and also can be controlled with some form of medication.
Oh.
All right?
Okay.
So it got to be combined,
So, and it's
depending
also-
on the degree.
Okay, and it's also genetics.
Yes. Actually, that's one of the major reasons, one of the major reasons of ADHD. So in other words, if one of the members of the family has this kind of history, tendency is there's a big risk of having one in the family later on. That's one. That is only one. It can be hereditary. It can be hereditary, and it can be maybe during pregnancy the mother was exposed to a high risk of mercury. We people, we love to eat seafoods and everything, and there's some certain seafoods that they have mga high risk, like yung mga I love tuna, I love sushi, and yung ganon. The fresh tuna is one high in mercury, which should be avoided.
Especially when you're pregnant.
When you are pregnant, of course, we need this kind of foods, But then, you have to be very, very selective with the kinds of seafoods that you're going to take, most especially for pregnant mothers, And of course, the mothers and the infant or the fetus, they need this kind of nutrition. But they got to be selective in kind of. So, for example, one of the high risk of ADHD is the food intake, as I said, And one is the king mackerel. Yan,
Mackerel.
mataas na mackerel sa yan, sa
Mackerel.
mercury.
Yung mackerel
Okay.
nasa ano.
Okay.
Let's ask
Nasa
naman.
can, no?
Nasa
Yeah,
can.
okay.
Let's ask her partner.
Yan, Bianca. Yeah.
Yeah?
About ADHD?
About ADHD. You want to add something about ADHD?
Well, what I do notice about it is that untreated, it can have very negative effects. I mean, it can be, some people become criminals because ADHD is not addressed,
It's not intervened during the younger years.
And, I mean, because they're not understood as kids, it tends to snowball into like careers. Parang they don't have good careers, or maybe they even end up going to prison. And what's interesting is that, I'm sure Doctor will agree with me on this, hindi nahahalata yung mga, some people with ADHD or ADD, hindi nahahalata early on because sometimes they're so intelligent they're so intelligent that they hindi napapansin until siguro college or until they're working na meron pala silang ADHD or actually ADD. I suppose ADD is more subtle because ADD simply means your mind flies off. So hindi masyadong halata. Alam mo
Ako
yun?
yung partner.
Okay. Well, as you have said earlier, Doc,
Yeah.
pwedeng medication, ano? So,
Yeah, medication, combined with
Okay.
medication.
Anong klaseng vitamins or homeopathic remedies for this ADHD?
Actually, it's the most very popular, I would say, is Ritalin.
I'm sorry?
Ritalin.
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 Oo.
Okay.
So, Ritalin and Adderall. It's, this is more of the brain,
Yeah.
Usually, these are given to children, same thing with autism.
But, I know a lot, some people na nagtitake nung yung...
Some they say mega vitamins, but
Yeah.
I go more for foods. But those are to control the brain.
Pero hindi niyo po pwedeng i-take yung lifetime di ba po?
No. And it get to be controlled. It get to be controlled. So every now and then there's this check-up, by the psychiatrist, neuropsychiatrist, regular check-up by the doctors,
Partner, gusto kong balikan yung sinabi niya na bakit yung mga may ADD or ADHD nagiging criminals? What exactly yung ginagawa nila or something na hindi sila nagiging successful in their careers? Is it because they can't focus on one thing?
I think that's partially it, I mean, they can't focus, walang intervention. So, because walang intervention ever since before, they're not taught how to focus. Their ADHD is not addressed. So it carries on to, let's say, partners, or it carries on to interests, and then criminal behavior happens because people with ADHD sometimes parang nanganganak, nagkakaroon ng ibang behavior pa yan And yung parang dahil hindi sila naiintindihan, so sometimes ADHD can also coexist with other exceptionalities such as conduct disorder, and left untreated, kung hindi sila naiintindihan, if they're not understood, it becomes more complicated, and sometimes it just criminal behavior can be the worst comes to worst scenario.
Gusto ko malaman, can you give us an example ng behavior ng ADHD? Sila ba yung yung parang kasi minsan napapanood ko na parang nagkakagulo na dito pero siya nakafocus lang sa isang...
that's a different thing.
Autism
That's
ata yan.
another
So, ano
exceptionality.
yung ADHD?
Okay, very common because of the word attention deficit.
Deficit
Number
disorder.
one is, there are 3 types actually. Let me please explain.
Please.
Not all children with ADHD are the same. That depends on the characteristic. Some can only have ADD, attention deficit disorder. So
Okay.
these are children who are predominantly inattentive type. They cannot focus. They have difficulty in receiving instruction, comprehension. That is why the common problem of these children persists or exists inside the classroom. And they look very normal, very deceiving. And sometimes teachers would just have to blame it to lack of comprehension. The thing, it's not comprehension. That is the imbalance, chemical neurotransmitter that exists within the brains of the person. Like for us, for example, we regular people, we have so many senses, the parts of the brain, it has so many functions. So, normal ang takbo niyan. But for people with our children having ADHD, as I said, there is this imbalance in the chemical messengers or transmitter. So, ano ibig sabihin nun? For example, your brain would tell you, okay, go there and pick that up. But for children with the ADHD, they perceive a different kind of meaning. They would run to something else and grab it immediately, and they behave inappropriately in most of the time. Yun yung mga ADHD. But for ADD only, so focusing lang ang problema nila. Ngayon, there's another type which we call predominantly hyperactive or impulsive.
Okay.
Ano yun? So, the word hyper itself, so they alagang hyper, tayo yung kami
Hyper kami.
Parang are you impulsive? Do you easily get mad? Do you throw out these things in front of you when you get mad? Do you just touch out all of these?
Hindi naman po!
Impulsive. And you black.
Hindi po kami ganun.
Hindi ka pa. You're not. Siguro ka pa lang sa ano.
Nasaan siya? Nasaan ka lang?
Hindi pa lang. Smiled.
Mild ADHD partner.
Oo. So, yun yung mga estudyante ba sa school wherein who will blurt out answers without being called. Madaldal din sila. Kaya sometimes we have, we manifest the same day.
Madaldal.
Kasi ako naman ngayon never anything that keeps on moving.
Super daldal.
Kaya nga hyper. Oo. Then the last type is the combined.
Okay.
Yung combined, pinagsama mo yung una, yung ADD and the hyperactivity.
Ay, hindi na
you
tayo
have
yun.
everything. Yun yun. Yun yung ADHD talaga. Alright?
Okay.
But, in fairness to these children, please, don't get us wrong. They can have a very sparkly personality. And there are a lot of famous people, no? Who were diagnosed.
Yes, oo.
Maybe you are
Robin
aware of
Williams
it.
is one of them, I think.
Oo, there are so many.
Okay.
And, yeah. Okay.
Okay. Nako, kailangan natin siya makat partner. Pero meron po ba kayong mensahe sa ating mga parents and teachers out there?
Okay. Okay, for everyone, most especially those people dealing with ADHD, mga teachers, mga parents, neighbors, and friends, take note that ADHD is absolutely not the result of bad parenting. That's a common misconception, ano? And as I said earlier, they have pleasant personality.
Pleasant.
They are risk-taker. Pagkatapos po ng eskwelahan niya, pag-graduate ng school niya, they learn differently. They become successful in life because nobody is already trying to control them. But of course, the bottom line here is early intervention. So parents, if you notice something, mukhang at risk ang anak ko, of all of these indicators of ADHD, try to seek for the assistance of medical practitioners, psychiatrists, psychologists, to have your child diagnosed and intervene early. That's the most important. Early intervention. And it can be treated, as I said.
All right.
Okay.
Anyway, thank you so much, Doctora. And I'm sure some of our viewers will be interested to know where they can reach you.
Yeah. Okay, my company is Reach Incorporated. We are located at the second floor of Metro Mall. My telephone number is 871-5167, 873-3438. So we do conduct assessment, we administer assessment, and we develop plans so we can intervene early for your children. And we have made a lot of success for these children.
And you, Bianca, do you have any message for our televiewers?
Well, I agree with Dr. Serrano that early intervention is something that you can't take too lightly if you notice that your child is at risk for anything at all. I mean, this is not really directly related, but we're also helping somebody a little boy who's delayed in terms of his speech. And you can't underestimate the effect that early intervention has on this boy. And the repercussions that can happen if left untreated. I've seen people who have had a lot of intervention and people who have not had a lot of intervention, and there is such a big difference.
Okay.
Alright.
Okay.
Okay. Tsaka, ang pinaka-ano doon, partner, kung halimbawa isang bata merong ADHD, wag natin pagtawanan.
Yeah.
Diba? Yun ang pinaka-the best. No?
That is true. Very
Alright, thank you so much, Miss Dr. Lolita Serrano and Miss Bianca Vot.
Thank you
Thank
so
you.
much.
You're
Okay.
most welcome.
Thank you. Stay with us because up next is Paracord. Only here on Rise and Shine!